p.m. on January 11th, 2021, and I am calling the Human Affairs Committee to order via teleconference. As chairwoman of the Human Affairs Committee, I find that due to the state of emergency declared by the governor as a result of the COVID-19 pandemic, and in accordance with the governor's emergency order number 12, pursuant to Executive Order 2020-04, this public body is authorized to meet electronically. Please note that there is no physical location to observe and listen contemporaneously to this meeting, which is authorized pursuant to the governor's emergency order. However, in accordance with the emergency order, I am confirming that we are providing public access to the meeting by telephone with additional access possibilities by video or other electronic means. We are utilizing Zoom, and the meeting link can be found on the agenda as well as on the city's website. You can also join by telephone by dialing 1-929-205-6099. The meeting ID is 880-2922-4683, and the passcode is 222695. The public may also view this meeting on Comcast Channel 16. We previously gave notice to the public of the necessary information for accessing the meeting through public postings. Instructions have also been provided in the City of Nashua's website at nashuanh.gov and publicly noticed at City Hall and Nashua Public Library. If anyone has a problem accessing the meeting via phone or Channel 16, please call 603-821-2049 and they will help you connect. In the event the public is unable to access the meeting via the methods mentioned above, the meeting will be adjourned and rescheduled. Please note that all votes that are taken during this meeting shall be done by roll call. Let's start the meeting by taking roll call attendance. When each member states their presence, please also state whether there is anyone in the room with you during this meeting, which is required by the right to know law. Alderman Wilshire?
Thank you. Alderwoman Kelly.
I'm here, I'm alone, and I can hear everyone.
Alderman Harriet Gathright. Alderwoman Clay.
I am here. I can hear everyone. And I am alone.
Alderman Karen.
I am here. I am alone and I can hear everyone.
And Alderman Wilshire is here. I am alone and I can hear everyone. We have 4 members of the committee present. Also on the line, we have Alderman Lopez. We have a quorum.
Thank you. All right. So the first item of business is public comment. Is there anyone from the public that would like to give comment on this evening's agenda items? If so, raise your hand. I don't see anyone from the public, but I'll just call one more time, make sure I didn't miss anyone. Okay. We have presentations, we have none. Communications?
We have none.
Unfinished business?
None.
New business resolutions?
Tonight we have resolution 20-102 relative to the acceptance and appropriation of $35,000 from the state of New Hampshire Department of Health and Human Services into Public Health and Community Services Grant Activity COVID-19 Vaccine Grant. I will make a motion to recommend final passage by roll call.
The motion is for final passage. Is there discussion on this motion? It seems straightforward, but I know Director Bagley is here to give us an update if we need. I see you.
Yes, thank you, Alderman Kelly. This $35,000 is given to us by the Department of Health and Human Services. And these funds are to be used to help with our COVID vaccination clinic, as well as enhance our adult flu vaccination clinics as well. The funds are to be used to help us when we set up the community clinics throughout our public health network services region to make sure that we have the technology to be able to do the registration of clients when they come to get their vaccine, as well as enter their information into a database so that could be collected and recorded. I don't know if there are any questions, but it's just that straightforward. It's all for the work that we need to do to get the vaccine into arms in our community.
Very important work, Director Bagley. Thank you. Does anyone on the committee have a question for Director Bagley? Are there any hands raised? I'm looking.
I don't see any.
Yell at me if I'm missing you. I don't see any either. I just had one question, Director Bagley, not necessarily connected to the funding, but you said you're going to be setting up clinics. How do the people who are going to get the vaccines find out, when it's their turn? Is there a little bit of information that you can share there?
Sure. So right now, the state is rolling out its vaccination allocation based on our most at-risk individuals for hospitalization or death. And so the strategy is to get our healthcare workers vaccinated, first responders, so that we have a workforce that can respond to this pandemic. And then to also make sure that we can vaccinate those who are at the highest risk of hospitalization or death based on comorbidities. And so we're phasing this out. Phase 1A was to focus on those healthcare workers, first responders, and those that are in the hospital settings, as well as long-term care settings. 1B is rolling out in the next couple of weeks, and that will include individuals that are over the age of 75, as well as those who have comorbidities, 2 or more health conditions that, again, put them at greatest risk for hospitalization or death as a result of this pandemic. And so what the plan is for getting those vaccines into arms, right now, the National Guard is set up at National High South, where they are doing the vaccinations for the healthcare workers, the healthcare providers, and individuals that fit into the category that work for agencies that are also providing services for clients that are at high risk. So that's where they'll be doing that at the fixed site at National High South. Then we have the opportunity to look at doing what we call closed pods, and that's where agencies can get connected with us as the Public Health Network Services lead to schedule either the health department coordinating and getting vaccine for them to administer at their sites if they have people to do that, or connecting with us. We set up clinics at their site, and then we provide the staff and the vaccinations, and we administer vaccines on site for those places. We are also looking and preparing, and in fact, we had a meeting today preparing to look at doing vaccinations in the clinics, vaccinations in the community that are clinics run by our health department with the support of volunteers for our community, so that we can make sure that individuals that can't get to either and not a part of an organization to do a closed pod, can't get to their practitioner's office to get a vaccination, will be able to do that through some of these clinics that we're going to get set up. What the state is now working on, we have a vaccine management system, and we need to have that in place because we want to make sure that we're tracking the vaccine that's being administered and be able to follow up with people to see what some of their reactions might be as a result of this vaccine, which is typical with any vaccine that you get. There could be a reaction. So we're setting up systems through the state where we can register individuals so that there is accountability in our vaccine allocation and distribution. So people will be able to either get signed up and registered through their primary care providers, or through those closed pods that I just mentioned, or through clinics that we're going to set up in the community, and then we will register them into this vaccine management system. So there's going to be several different ways in which that can happen. At this point in time right now, the state is still getting that set up, this vaccine management system, so that it is accessible. Primary care providers are being onboarded. That work started last week. And then once that's all set, they will be able to, individuals will be able to contact their primary care providers and get registered for the vaccine. And then once the system is set up for us to be able to register folks, that information will be communicated out through the various means that we push out information, and folks will be able to move forward from there. We're still looking at another probably 2 weeks before that 1B phase actually does kick off, because they're ramping up this registration vaccine management system. They're ramping that up right now. They're actually phasing out of one system that they use for the responders and the healthcare workers that we were all enrolled in that one, and they're trying to get another one that's set up that works a little bit better, because there were some barriers or some challenges with the vaccine system that's in place right now. So we need something that's going to work, that's going to be effective, and it's going to be easy to use for the public once it is rolled out.
Thank you so much, Director Bagley. I know that is, secondary to this piece of legislation, but I think it's really important information for everybody to have. So thank you for that. Does anyone else have any questions? Oh, Alderman Clee has her hand up.
Thank you very much, Madam Chair. Director Bagley, again, related to basically what you were talking about, when you said that the primary care they would be creating their own registry, is that the way it would work? So if I were 1B, I'm not, but if I were 1B and I knew that it had started, I would contact my primary care to be registered, if I had one. It's not going to be a Walgreens or a CVS or anything else like that. Is that correct?
Correct. And all of us will be using the same vaccine management system. And so the grant that we're getting allows for us to make sure that we have the technology so that we can actually capture that information right on site at these vaccination clinics. So we have to have the laptops, we have to have the software to be able to do this right on site. So the grant dollars that we're getting allows for us to purchase these laptops so that we can actually be able to collect and register and get this information in real time with the folks that are participating in these vaccine clinics. But all of us will be using the same vaccine management system, so everybody will be registered into the same system. And it's the first, because we haven't had, we haven't had an immunization program in the state of New Hampshire where we had a registry. This is going to allow for us to be able to do that.
Madam Chair, may I have one quick follow-up?
Yes.
Thank you. Thank you, Director Bagley. So I did understand that correctly. Then this will all be into one centralized database. Is that correct?
Yes.
And so if I were to go to, say, St. Joe's family and they were to enter it in, it would go in, you would be able to see from your end that I had the vaccination and so on, or not necessarily you, but the powers to be up in Concord or something of that nature.
Yes.
Thank you very much. I'm done, Madam Chair.
Let's go ahead. Thank you. I just want to note for the record that Alderman Harriet Gathright has joined us. And I see your hand, Alderman Lopez. Welcome, Harriet. Linda, nice to see you.
Thanks. I'm being called on, right?
Yes.
Okay, just making sure. I have two questions for Director Bagley. The first is, my understanding is the state has discontinued contact tracing, but is the vaccine tracking system a local attempt, or is it a state attempt, or is it a state effort? And do we have control over that so it doesn't get discontinued?
Hi, Alderman Lopez. So we have not discontinued contact tracing. What has changed is that it has been prioritized. The number of cases that comes in has exponentiated over the past several months. From October through December, our numbers have just exponentiated. And so what we're doing with contact tracing, it's prioritized. And so what that means is when we do our disease investigation and we identify a case, the individuals will give us all the information that we need, to make sure that they isolate, and then we're gathering information from them on their potential contacts. And then the expectation that we have is that they will work with us to make notification, of folks that have been exposed. Those individuals can then follow up either with testing and then follow up that way. And so we're doing it's modified in a way so that it's prioritized. In the past, we used to call every single contact. And we're not able to do that because we just can't keep up with that. And so it's modified to where it's prioritized so that we're following up on outbreaks. We're following up on cases that occur in congregate settings. And we're following up on individuals over the age of 60 and individuals under the age of 18. So it's modified. So we're still doing it, but we, for instance, we have over 400 and I believe the number this one was either 450 or 460 active cases. And so each of those cases would then have contacts. And so in fact, this over the weekend with some of the investigation in one household, I investigated all of the members, had tested positive, and then I would then follow up and investigate all of their contacts. And so we're not connecting all of those folks that way. So it's just modified to prioritize. With regard to the vaccine management system, once this is in place, this is going to be here and it's going to actually help us because we haven't had an immunization registry in the past. And so once this is set up for COVID, the idea is that this will be used beyond just getting COVID vaccination into this vaccine management system, but we'll be able to get all of our other vaccines in there as well. So I don't anticipate this going away, but it'll be something that statewide and at our local health departments and our doctors' offices will be able to use these things going forward. So as Alderman Clee mentioned, if we needed to be able to go in and look at, we could see because we'll have this vaccine management system in place.
Okay. I guess the basis of my question was, is this something the city controls versus the state controls?
The vaccine management system is controlled by the state, and we will have access to it as a third party to be able to register individuals who sign up for the vaccination. We'll be able to register them into that system.
And then my second question was with regards to satellite clinics that might potentially go out as part of phase 2 or later. Are we looking at a plan to get public housing as locations and maybe senior focused housing as well? Mary Sweeney Center or any of the Sullivan Terraces where there's a high population of people with elderly and low access to income, and you can literally set up a clinic right there so they don't have transportation barriers.
So Alderman Kelly, can I address that?
Yes, Director Bagley.
So yes, Alderman Lopez, we actually did talk about that today in our planning for clinics because we know that we're going to have to be able to meet people where they are. That is a plan of the vaccine allocation. That is the expectation of our public health network of regions, that clinics are set up in areas and in neighborhoods where we have the highest risk of populations that meet the criteria. So those are over 75, individuals that are identified that are disproportionately impacted by COVID, so our racial and ethnic minority populations. And so our goal is to get into the community at the sites so that folks can have access to us. So that would include making sure that we have clinics set up as close to those places as possible. We're looking right now at trying to do as many mobile and drive-through clinics as we can, again, to reduce exposure to folks and not have people gather together in small places, waiting to get the vaccine. So we're going to roll these, you call them satellite clinics. We call them like open pods. We're looking to roll these out in places where we can, continue to do the drive-through and have folks get vaccinated that way. But yes, go closer to those sites to be able to do this.
Madam Chair, if I can just ask one final question, it's pretty brief.
Yes, go ahead.
So January 29th is the point in time count. It's the annual attempt by the city, state, and other partners working with homeless people to identify exactly how many people are unsheltered and how many are homeless. So it's also the day where all nonprofits and state organizations working with those populations are working together. Did we happen to have any luck in organizing a clinic for that day?
We have not as of yet because January 29th, we're hoping, Alderman Lopez, that we're able to roll into phase 1B by that time. Mm-hmm. So we're giving ourselves that 2-week, and we do not have a finalization on that as of yet.
So it's like two people trying to high five and they're just a little bit too far away. Is there a way that we can coordinate with those agencies to record how to get a hold of people?
Yes, that's something that
Because
can be.
sometimes you get people who rarely come in out of the woods, or you didn't know they were homeless, or they're staying with friends or family or something like that, and they're really hard to get a hold of. So if we could have them opt into some kind of system where city health, public health could figure out where they are, maybe that would be helpful.
Yes, sir. Thank you.
Alderman Lopez.
Okay, thank you for your,
All set,
yeah,
Alderman
I
Lopez?
appreciate your time.
Of course. Alderman Harry Gathright, please.
Thank you, Madam Chair. My question is, so you have the option to go to, let's say, your private doctor, or you can get in the mobile line for the health department, correct?
That's what we're planning. And again, we're going to do our due diligence to the fidelity of the vaccine allocation phases. And so, and the primary care providers are planning to do that as well. And so we're going to stick to those groups that are identified, but that is our plan. That is the plan of the state as well. We know that private practitioner offices will be overwhelmed if everyone tried to go to their primary care provider to get vaccinated. We also know that not everyone has a primary care provider. And we also know that there are folks that don't have the transportation and won't be able to do that. And so we need to set up these secondary ways and clinics if we are truly to be as effective as we want to be with making sure as many as want to get vaccinated can get vaccinated without barriers to making that happen for them.
Thank you.
Anything else, Alderman Harry Gathright?
I'm
Are you
all
all
set,
set?
thank you.
Do any other aldermen have questions? I don't see any. Can we please call the roll?
Certainly, the motion before us is to recommend final passage of resolution 20-102. Alderwoman Kelly,
Yes.
Alderman Harriet Gathright,
Yes,
Alderman Clee,
Yes.
Alderman Karen,
yes,
Alderman Wiltshire is a yes. We have 5 yeas, 0 nays.
And that motion carries. Director Bagley, thank you for your insight and information for everyone surrounding this.
Thank you. Thank you for your consideration with passing this.
Okay. New business ordinances,
We have none.
tabled in committee.
We have nothing.
Would anyone like to make general discussion? Alderman Gathright, I assume your hand's up from before. Yes, yeah, okay. I don't see any general discussion. Are there any remarks by Alderman? Looks like everybody's quiet, okay. I think that is all. Do I have a motion?
I'll make a motion to adjourn.
The motion is to adjourn. Any discussion?
Oh, sorry.
Nope, that's fine.
Alderwoman Kelly,
I'm a yes. Thank you.
Alderman Harriet Gathright,
yes.
Alderman Karen,
yes.
Alderman Clee,
Yes.
Alderman Wiltshire is a yes. We have 5 yeas, 0 nays.
That motion carries and the Human Affairs Committee is adjourned at 7:23.